This cream is used to moisturize and treat dry, rough, scaly, itchy skin, as well as minor skin irritations such as diaper rash and skin burns from radiation therapy. Emollients are ingredients that soften and moisturize the skin and reduce itching and flaking. Some products, like zinc oxide and white petrolatum, are mainly used to protect the skin from irritation, such as from wetness. Dry skin is caused by a loss of water in the top layer of the skin. Emollients and moisturizers work by creating an oily layer on top of the skin that traps water in the skin. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone. Humectants, like glycerin, lecithin, and propylene glycol, draw water into the outer layer of the skin. Many products also contain ingredients that soften the top layer of skin cells, helping dead skin cells fall off and the skin to retain more water, leaving it feeling smoother and softer. Make sure to use this product as directed. Some products may need to be shaken before use. Check the label to see if you should shake the bottle well before using. Apply the cream to the affected areas of the skin as needed or as directed on the label or by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to use the cream every time you wash your hands, applying it throughout the day. If you are using this cream to help treat diaper rash, make sure to clean the diaper area well before use and allow the area to dry before applying the cream. For those using this product to help treat radiation skin burns, check with radiation personnel to see if your brand can be applied before radiation therapy. It's important to follow all the directions on the label for proper use. Apply the cream only to the skin and avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed otherwise by the label or your doctor. Make sure to check the label for directions about any areas or types of skin where you should not apply the cream. If you have any questions, consult your doctor or pharmacist for more details. Use this cream regularly to get the most benefit from it. Most moisturizers need water to work well, so apply the product after bathing/showering while the skin is still damp. For very dry skin, your doctor may instruct you to soak the area before using the product. Keep in mind that long, hot, or frequent bathing/washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, make sure to seek medical help right away. Using Emollient combination No. 53 cream is generally safe and effective, but some people may experience burning, stinging, redness, or irritation. If these side effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication for you, it means that they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you notice any unusual changes in your skin, such as it becoming white, soft, or soggy from excessive wetness, or if you see any signs of a skin infection. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help right away if you experience symptoms such as a rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. Remember that this is not a complete list of possible side effects, so if you notice any other effects that are not mentioned here, it's important to consult your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Emollient combination No. 53 cream, make sure to consult your doctor or pharmacist if you have any allergies or if you have skin cuts, infections, or sores. Some ingredients in the cream may make you more sensitive to the sun, so be sure to check the label for any warnings and take special precautions when outdoors. If you are prone to acne breakouts, look for the word non-comedogenic on the label to avoid worsening acne. Additionally, some products may stain or discolor clothing, so be sure to ask your doctor or pharmacist for more details. Before undergoing surgery, inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this product, especially if you are applying it to the breast area. It's important to note that emollient combination number 53 cream may interact with other medications, potentially affecting their effectiveness or increasing the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is ingested, it can be dangerous and cause serious symptoms such as loss of consciousness or difficulty breathing. In case of overdose, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. To prevent dry skin, it's important to use lukewarm water when bathing, limit baths/showers to every 1 to 2 days, keep baths/showers short, and use a humidifier in dry air. Emollient combination number 53 cream is just one of the many types of emollient products available. It comes in the form of a cream and is used to help moisturize the skin. It is important to consult with your doctor or pharmacist to determine if this product is the best option for your skin. The recommended daily dosage and optimal timing for using this cream will vary depending on your individual needs, so it's important to follow the guidance of your healthcare provider. If you forget to use this cream as scheduled, apply it as soon as you remember. Do not use extra cream or apply it more frequently than directed. Make sure to check the storage information on the package. If you have any questions about how to store the cream, be sure to ask your pharmacist. It's important to keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or an open flame, as it is under pressure. Do not puncture or burn the canister. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.